So how many of you know about the hypoxia, as it is very common term? Okay, so actually it is the insufficient supply of the oxygen to the tissues, right? Or you can say the inadequate oxygen supply to the tissues, right? So we can differentiate the hypoxia between the two terms, like we are having the local hypoxia and we are having the generalized hypoxia. Okay, local hypoxia refers that if some particular tissue is having the deficiency of oxygen, okay, or if some tissue is not able to getting the proper amount of oxygen, that particular tissue is getting hypoxic, right? But if you will see about the generalized hypoxia, it is usually the systemic hypoxia whenever the blood is having some issues for the transportation of the oxygen, right? So if you will talk about the blood components, we are having the plasma and the formed elements, right? So formed elements are about, we are having the RBCs, which is the erythrocytes, then we are having the white blood cells, then we are having the thrombocytes, which are the platelets, right? So if you talk about the oxygen transportation, because I am referring about the hypoxia, we have to consider about the oxygen, right? So who transports the oxygen if I am talking about the elements or the components of the blood? RBCs, right? Erythrocytes. So what is present inside the RBCs actually? Hemoglobin, right? So hemoglobin carries the oxygen and it supplies to the different tissues. Okay, so what is happening? Cells are making up the tissues, tissues are making up the organ. Okay, so you can understand the importance of the oxygen. So if the any kind of tissue, any kind of cell will be hypoxic, if particular kind of cell is hypoxic, then cells are making up the tissues, that particular tissue will be hypoxic, and tissues are making up the organ, that organ might be getting hypoxia, and eventually what may happen, it will be that particular organ may be ischemic, and then eventually that organ failure might happen. Okay, for example, that thing happens in sepsis, that is a different story. So hypoxia, what is hypoxia actually? It is the insufficient oxygen supply, right? Okay, now if the patient comes and he is having the symptom, he or she is having the symptoms of the hypoxia, how can you understand the situation for the hypoxia if any patient comes, okay, and how can you differentiate those patients? So we are having two things, that one is the early signs and one are the late signs. It depends on the patient, that whether the patient comes to you as quick as he or she can, or if there is a delay. Okay, so there are early signs and there are late signs. So what happens is, you are having the two types of mechanisms in your body, okay, and that thing you will be studying in the pathophysiology. So for the third year students it will be much clearer. So there are the compensatory mechanisms and there are the decompensatory mechanisms, right? Now what does it mean, compensation and the decompensation? Compensatory mechanism means your body tries to equalize the things for you. For example, if you are having hypoxia, it will increase your heart rate so that your heart is pumping faster, okay, and it is pumping the blood through the aorta to your body organs, so that your tissues are getting proper amount of oxygen supply. Okay, after some time, if the patient remains untreated, okay, what should be treatment? You need to give them oxygen, right? If the patient comes to you, let's say after 30 minutes or an hour, it depends on the hypoxia, because look, what are the two important organs inside our body? These are the brain and the heart. If they will be hypoxic, okay, you need to, doctors don't care about other organs, but doctors care about, first thing is brain, second thing is heart. If they will be remaining hypoxic, okay, the patient will be having the severe consequences. For example, if the brain is not getting a proper amount of oxygen for a minute, let's say, okay, various kind of neuronal imbalance can be seen in such patients. Okay, if I am going too fast, you can just remind me, okay, with the speed and all. I hope you are with me, right? Okay, so let's say we are talking about the early signs first of all. So let's say here are the early signs, and here will be the late signs also of those patients. So what I want to say, that this will be the compensatory mechanism from your body side, and if this patient remains untreated, these early signs will be converted to the late signs, and then these are the signs for the decompensation. That now look, everything is having their threshold, everything is having the limitations. Okay, heart cannot beat faster for about 4 or 5 hours, right? So heart is giving you the indication that it need the body, the patient needs the some kind of treatment. Okay, so if you have to recognize the early signs and at the same time you need to treat your patient, otherwise these signs will be converted to the late signs, and that will be the decompensatory signs. Okay, so let's talk about what are these kind of signs. So here is one mnemonic you can easily remember by those one for those signs. It is the ART. Okay, A for its anxiety. Okay, so the patient will be having the anxiety, the patient will be having the hard time to breathe. Okay, they will not be able to breathe properly, because if the oxygen is not there, and if the patient is demanding for the oxygen, they will be asking for more and more oxygen. Okay, one thing to remember, if you want to give them oxygen as well, okay, they will not allow you to do so, because what they will think that you are choking them by giving the oxygen mask. Okay, so sometimes you have to hold the patient. Okay, you need 3 or 4 doctors to calm over the patient, and then you will be giving the oxygen supply. Okay, because the patient will be so extremely restlessness situation will be there. Okay, so over here anxiety, then it will be the restlessness with the R. Okay, T for what will be the situation as far as heart is concerned? Tachycardia, higher increase in heart rate, that is the tachycardia. So tachycardia will be there. What will be happening to the respiratory rate? It will be increased. So can I say tachypnea? Right, tachypnea. So these are some kind of early signs of the hypoxia. Okay, till now everything is clear. Okay, now let's move over to the, so this was the compensatory mechanism from your body side. Okay, so your body is trying hard to, your body is just trying to make sure that your organs are not becoming hypoxic, because once your organs will be hypoxic, then this condition might convert into the ischemia, and then organ failure might happen. Okay, and then there will be very less chances of the survival of such patients, right? Coming over to the late signs. So what will be the late signs? Some situation will be opposite to this situation. For example, I told you about the heart rate. Over here it will be tachycardia, right? So heart rate will be increasing, heart rate will be increasing, right? In this case, as the condition is transferring into the late signs, into the decompensatory situation, here you will be having the bradycardia. Here you will be having the bradycardia. Bradycardia means slower heart rate, right? Now what other signs you may see? That is the cyanosis. What is the cyanosis? Cyanosis is the bluish discoloration of your skin. Now in what cases your body might turn its color into the bluish one? Whenever your body is demanding for the oxygen. Okay, and what is the situation over here? Hypoxia. If you are seeing some patient that his or her body is turning its color into the bluish one, is it the early sign or late sign? Is it the emergency situation? Is it the emergency situation or not? This one is the emergency one, because already the body is converting its compensatory into decompensatory mechanism. These are the signs which are giving you the indication that your body is now failing. They needs the treatment urgently, right? So cyanosis will be there. With that, your body will be, this patient body, not yours body, this patient body will be asking for the oxygens in any case. So dyspnea will be there. As far as late signs are concerned, restlessness was here also, but restlessness will be increasing as this patient is lacking the treatment. As this patient is losing the time, this patient restlessness will be increasing. So extreme restlessness will be there in the late signs. Okay, so these are the signs by which you can identify the picture of such patients. Okay, am I clear till now? Am I audible? Okay, thank you. So let's talk about the types. So for the ease of understanding of this topic, what we did is that we have the types of the hypoxia. Okay, so that we can look over the types, we can look over the etiological factors. Okay. So now let's talk about the types of the hypoxia. Okay. Shall we continue? Shall I rub this portion? Okay, so let's talk about the types of hypoxia. So basically we are having the 4 major types of hypoxia. These are the hypoxemic hypoxia, hypoxemic hypoxia, ischemic hypoxia, then anemic hypoxia, and then you are having the histotoxic hypoxia, or you also call it as tissue hypoxia. Okay, you also call it as tissue hypoxia. Okay. Now remember, I am talking about, we will be elaborating each and every one, okay, each and every type. But remember that anemic hypoxia, this is the different kind of hypoxia, this is the anemic one, okay, and anemia is a different topic. Anemia is a very wide topic, and at the same time it is very important. We will be having one class separate on the anemia. Okay, we will be having the different kinds of anemia, for example, hypochromic anemia, normochromic anemia, hyperchromic anemia, right? Okay, so let's elaborate each and every one. So I will be starting with the hypoxemic hypoxia. Okay, so shall I rub? So what does it mean, hypoxemic hypoxia? Hypo means low, ox over here is oxygen, and emia means blood. So this is something that low amount of oxygen inside the blood. Okay, that's it. So this is the hypoxemic hypoxia. Now what can be the factors which can induce hypoxemic hypoxia? Okay, so let's talk about those factors. So what will happen if you are, let's say that you are going on a trip and you are climbing the mountains. Okay, you are climbing the mountains and you are on some specific height. For example, you are 3000 meter away above the sea level. Okay, and at that time, so let's say that you are at higher altitudes. Okay, higher altitudes. So you might be experiencing this thing. So you know what happens there, that you will be asking for more and more oxygen. Am I right or wrong? Yes. Right, you will be asking for more and more oxygen. Okay, so what will your body do? First of all, you will be hyperventilating. What is hyperventilation? Yeah, you are increasing your breathing rate, right? You are increasing the duration of the inspiration and you are increasing the duration of the expiration at the same time, right? So you will be doing the hyperventilation. At that time, inside the blood, oxygen level decreases. Now why the oxygen level is decreasing inside the blood? For this you need to know the mechanism, how you are taking the oxygen, how you are exchanging actually the oxygen and carbon dioxide between your lungs. Okay, and you know, have you heard about ventilation perfusion ratio? Ventilation perfusion, actually ventilation is you are taking the oxygen inside till the lungs. Okay, and that oxygen which is getting deposited in the alveoli, from the alveoli it goes into the blood, that is the perfusion actually. Okay, let's talk about this through a diagrammatic representation. So over here, a very simple diagram. Okay, let's say this is the trachea, here are the tracheal rings over here, and you know, here you are having the bifurcation, and here the bronchi are coming, then you are having the bronchioles, okay, on each side. Okay, and actually respiratory division is having, in total you are having the 17 divisions from here till the lungs. Okay, I am not talking about those divisions actually, but for now you just understand that this is the functional diagram. Okay, so let's say that this is the trachea, then the bronchi, then there is the bronchioles, and eventually you will be having alveoli. So let's say here are the alveoli, right? Okay, here are the alveoli over here, and this is something like, okay, These are the lungs. Now what happens is, Krishna's told you something about heart, right? That from the right ventricle, which branch is coming? Pulmonary vein or artery? Pulmonary artery. Very good. So pulmonary artery will be approaching the lungs. Okay. What is the purpose? For the oxygenation purpose, right? Oxygenation is the main purpose. So let's say that this pulmonary artery is coming from the heart. Okay. This pulmonary artery is coming from the heart. Eventually it will continuing into the pulmonary vein. Actually pulmonary artery, then pulmonary arterioles will be there, then capillaries will be there, then venules will be there, then veins will be there, right? Okay, we will be talking about the blood capillaries and in the separate class. Okay, so let's say I'm skipping that capillary and all part. Okay, let's draw the capillaries as well. So because the capillary will be responsible for the exchange purpose. Okay, fine. So what will happen? You take the oxygen inside, right? Oxygen is coming here, carbon dioxide is coming out. Oxygen will eventually go into the alveoli. Okay, now that oxygen from here till here, this part is the ventilation. This part is the ventilation. From here, whenever it will go into the blood vessel, okay, whenever it will go into the blood, this will be the perfusion. That's why we say ventilation, perfusion. Okay, ventilation, perfusion, and usually we say ventilation perfusion ratio normally is about 0.8. Okay, so ventilation perfusion. Okay, so what will happen? Oxygen will be coming to the alveoli, and this oxygen has to go into this blood. Okay, now what is the rule of nature? Things goes from high pressure to the low pressure. Okay, now look, if you talk about the oxygen partial pressure over here, okay, it will be around 104 millimeter of mercury, right? This is the oxygen. From the right ventricle of the heart, which kind of blood is coming? Deoxygenated or oxygenated? Deoxygenated. The purpose is oxygenation. So what is the partial pressure over here? 40 millimeter of mercury, right? Things likes to go from high pressure to low pressure. What will be the direction of the oxygen then? It will go from here to here. Okay, what will be the content of the carbon dioxide over here? It will be somewhat high. Let's say hypothetically I am saying, let's say this is the 30 over here and 10 over here. Now the carbon dioxide movement will be like this. Okay, so that's how the exchange process happens. Okay, so CO2 will be going from the blood into the alveoli, and eventually you will be removing that CO2 out with the help of these bronchioles, bronchi, until and unless you are not having any kind of pulmonary disease such as COPDs, right? So one thing is that if you are going towards the high altitudes, you will be lacking the oxygen. You will be lacking the oxygen. That can be included in the part of hypoxemic hypoxia. Hypoxemic hypoxia. So whenever you are approaching the high altitudes, oxygen content will be lower. Low content of oxygen will be going into the alveoli. Low content of oxygen will be present in the blood. Low content of oxygen will be transported to the left atrium of the heart, then left ventricle, and then through the aorta. Low amount of oxygen is going into your body tissues. So your tissues may be hypoxic in that situation. Of course, the compensatory mechanism will be activated, and that will not be much severe. Okay, let's go over to the next one. So one is the higher altitudes. One is the type whenever the patient is having some kind of pulmonary problems, pulmonary diseases. For example, one of the classical example of this is COPDs. What are COPDs? Chronic obstructive pulmonary diseases, right? So one of the example is COPD. Okay, so can you tell me what kind of diseases you can include under the COPD? Yeah, bronchial asthma is one of the example, one of the classical example of COPD. What else? Okay, let me clear first of all that you are having two kinds of pulmonary disease, like broadly I am saying. One is the restrictive, in which you are having the problem with the inhalation, okay, and one is the obstructive, in which you are having the problem while exhalation. Okay. COPD, what is the full form of COPD? Chronic obstructive pulmonary disease. So is it restrictive or is it obstructive? It is obstructive, one thing for sure, right? It is obstructive. So what are the COPDs? I am writing over here. Okay. Remember it from today till the end of your life, because it will be coming throughout your books, whatever exams you are writing, it should be in your mind. Okay. First of all, you told me bronchial asthma. Okay. Second one, you can include the bronchitis, actually the chronic bronchitis. Okay, inflammation of your bronchi. And third one is the emphysema. Okay, emphysema, which is the problem when whenever you are looking the chest X-ray film, and intercostal spaces will be much wider whenever you will be seeing that. I am not going to discuss that thing, that is the clinical part, not for you. So emphysema, chronic bronchitis and bronchial asthma, right? Now what is the problem in the asthma? For an example, you will be having hard time to exhale the air out, which means CO2 may be trapped inside your lungs. CO2 may be trapped inside your lungs. So CO2 content inside the lungs may be elevated or may be increased. Okay, due to that respiratory acidosis might happen. We will be having the class over the acid base imbalance, in which we will be talking about the acidosis and alkalosis, respiratory metabolic. Okay. Now bronchial asthma is actually having some kind of bronchoconstriction. Okay, some kind of bronchoconstriction. So let's say that this part is getting some kind of constriction over here. Okay. What will happen to the oxygen content now? Will you be able to provide the proper amount of oxygen to your alveoli? No. So what will happen to the perfusion, ventilation perfusion ratio? It will be decreased. Okay. So eventually in the blood there will be low amount of oxygen. Eventually in the aorta there will be low amount of oxygen. Eventually the tissues might be getting hypoxia. Okay. So clear about this one. What about chronic bronchitis? Same thing will be happening. Bronchi will be getting inflamed. So if you will talk about, let's say this is the bronchi, this is the bronchi. If I am talking about the bronchitis, there will be inflammation. What will happen to the lumen of the bronchi? It will be decreased. It will be decreased. So what do you think? This is better for the oxygen transport or this is better for the oxygen transport? This one, right? Here you are having much better passage, right? So look over here, chronic bronchitis, same problem will be happening, because due to the inflammation, low amount of oxygen will be going till the alveoli of the lungs, and then perfusion ratio will be disturbed, and eventually you will be having hypoxia of different kind of tissues, right? What about emphysema? Emphysema. In emphysema, actually what happens in this kind of problem, you are having the alpha 1 antitrypsin deficiency. Alpha 1 antitrypsin deficiency. Okay. Now what does it mean, alpha 1 antitrypsin? What is the function of this alpha 1 antitrypsin? Actually what happens is, you are having a special kind of enzyme, okay, from the macrophages, that is the elastase. That is the elastase. Now I am zooming this alveoli over here. Okay. Let's say here is the alveoli. Okay, I am drawing this alveoli look like this. In emphysema what happens is, alveoli becomes like this. Okay. So what is the problem over here? In this situation, what is the problem? Very good. Surface area decreased. Surface area got decreased. So look at the surface area over here. What is the significance of having good surface area in the alveoli? Yeah, so that we will be having proper ventilation perfusion, because if the surface area will be increasing, perfusion rate will be much more better. Okay, this is the emphysema situation over here. What will happen to the perfusion rate? It will be decreasing. Okay, so what will happen to the oxygen transfer to the blood? It will be decreasing. Eventually you might be having hypoxia, right? So what happens is, if you talk about the pathophysiology, what is the reason behind the emphysema is, you will be having the alpha 1 antitrypsin deficiency. Now, what is the function of alpha 1 antitrypsin deficiency? Actually, we are having a special kind of enzyme, that is the elastase. Okay, I am writing over here, that is the elastase. What the elastase does, it might come over here and destroy this surface area. Okay. Actually, if a person is not having emphysema, okay, for example, like me and you, we are not having emphysema right now. So, what is happening? Alpha 1 antitrypsin is regularly inhibiting this. Alpha 1 antitrypsin is regularly inhibiting this elastase enzyme. Okay, I am writing over here. Here is the alpha 1 antitrypsin. Okay, what it is doing? It is inhibiting the enzyme elastase. So, this is the physiological situation. This is the physiological situation when you are not having the emphysema problem. So, this is the elastase. So, it is inhibiting the elastase. Now, if the elastase is getting inhibition, will it be able to destroy the surface area? No, which is happening right now with us. Now, if alpha 1 antitrypsin will be deficient, will it be able to inhibit the elastase? No. So, elastase content will be increasing. Now, will it be able to destroy the surface area of the alveoli? Yes. We are having millions of alveoli inside your lungs. Okay. So, just imagine this situation, that if the surface area is getting destroyed for each and every alveoli, it will be very hard time for this person to breathe, right? Okay. So, did you understood how the COPD can cause hypoxemic hypoxia? Is it clear? Okay. Did you understand? Do you have any idea about the altitudes? Whenever you are approaching the higher altitude, then you might be having hypoxemic hypoxia. Understood? Okay. And third thing is about the ventilation perfusion ratio. Whenever ventilation perfusion ratio got disturbed, then you might be having hypoxemic hypoxia, which I have already discussed, right? Okay. So, this was about the hypoxemic hypoxia, ventilation perfusion ratio discussed. Okay. Now, if let's imagine one case over here, that the person comes to your hospital with the burning. Okay, there was the tragedy, some burn accident happened, and you know, this patient is coming with the late signs of the hypoxia. What were the late signs? Bradycardia, cyanosis and all these things, right? Now, what actually happens is, you know, you are having two things. So, what usually happens, which kind of poisoning happens in burning accidents? Let's say if a room is burning, somebody said carbon monoxide, very good. So, right now we are taking which gas over here? Oxygen. Okay. If the room will be burning, oxygen content will be decreased, carbon monoxide content will be increased. Now, what is the problem? Carbon monoxide gas, this is having the higher affinity, 200 times higher affinity than oxygen to bind to the hemoglobin molecule. Okay, to bind to the hemoglobin molecule. So, imagine this situation, that on one side, if you are having, I have to rub some portion. Shall I rub this? So, imagine this situation, on one side I am having 200 molecules of oxygen, on another side we are having 1 molecule of carbon monoxide, okay, and here is the hemoglobin. Here is the hemoglobin present over here, okay. Okay. Now, these two molecules are having same affinity to bind with the hemoglobin, okay. Now, imagine this situation. So, carbon monoxide can easily replace the oxygen binding capacity with the hemoglobin. That is why it is very, very dangerous, okay. So, that is why usually what happens in winters, some people used to have the smoke inside their room, okay, so that there will be much heating, okay, the environment will be much appropriate for the sleeping and all. So, it can be actually dangerous, because you know, while you are sleeping, you might be taking the carbon monoxide at that time, and what may happen then? Carbon monoxide affinity is 200 times higher than the oxygen. So, carbon monoxide, instead of oxygen which should be binding to the hemoglobin, carbon monoxide will bind to the hemoglobin, and then what will happen? RBCs are containing the hemoglobin. Of course, hemoglobin is containing the carbon monoxide at that time, and it will be giving the carbon monoxide to the tissues, and your tissues will be hypoxic. Severe hypoxia will be there. In those cases, hyperbaric oxygen should be given to these patients urgently. Okay, fine. So that was about the hypoxemic hypoxia and the carbon monoxide poisoning, CO poisoning. Okay, let's talk about the another one. So the next one was ischemic hypoxia. Do you have any doubt still now? So let's move on to the next one, that is the ischemic hypoxia. Okay, what does it mean, ischemia? Ischemia. Ischemia is actually the lack of, if some organ is having lack of blood supply, okay, that organ or that tissue might be ischemic. Okay, this is ischemia. Actually, what happens is whenever the ischemia happens, there is lack of blood supply. Let's say let's take the example for the heart. If the heart is getting ischemic, and if the heart is not getting proper amount of blood supply, okay, then this ischemic tissue might turn into the infarction. Okay, for example, myocardial infarction, right? So in the ischemic hypoxia, what happens is you are having less amount of RBCs coming from the heart. Now there can be two situations. For example, first one is that you can say heart failure. Let's say the congestive heart failure. Okay, what may happen in the heart failure? Your heart is like a machine. Okay, now your heart is getting tired due to some kind of reason. Okay, your heart is getting tired due to some kind of reason. If your heart is tired, left ventricle will not be able to contract properly. If the left ventricle will not be able to contract properly, less amount of RBC will be going to the aorta or more amount of blood? Less amount of blood will be going. If the less amount of blood is there, less amount of RBCs, less amount of RBCs means less amount of hemoglobin. Less amount of hemoglobin means less amount of oxygen, because hemoglobin is carrying the oxygen molecules with it, right? Now, if the condition is congestive heart failure, now let's say that this over here, this is the heart. Okay, from the left ventricle, aorta is coming out. Okay, let's say this is the aorta over here, and it is giving the branches into thoracic aorta and then abdominal aorta, and let's say it is giving some branches over here. Okay, it is giving the branching over here. Then you will be having the